Hi, I'm Haresh Mehta. I'm the consultant interventional cardiologist at PD Hinduja Hospital, Khar. So we started our valve program in 2017. It was very nascent stage that time. And that time very few valves was being done all over the country. And we realized that we have to give good outcomes. Once the outcomes start improving, more and more patients found out about us from the patients, and our experience kept increasing. So now we are 6 years down the line into this therapy and entering the 7th year, and we are probably one of the leaders in Western India, if not India, doing TAVIs, taking care of valve patients, taking care of good outcomes. So our team provides different coverage. When I mean different, how are we different? We are different because we have a team of more than 5 cardiologists. We have more than 2 cardiac surgeons. So we have anesthetists round the clock. Now why do we need 5 cardiologists? For example, why do we need more cardiologists? For example, if I'm on leave or if I'm not around, any member of our team can do this TAVI without my presence. And that's the most important thing, that we create a teamwork, and that is translated into better patient outcomes. And this can only happen if you have the experience of doing this. And we have also launched this clinic to train young cardiologists, train young minds into this therapy. So the experience grows exponentially. And that's why I feel that Hinduja Khar is the place to get your valve procedure done, for we have the maximum experience in this area. So what I want to discuss now is that we are not only TAVI people. We're not going to do only TAVI in Hinduja. We want to look after something called structural heart. Now what is the difference between valve and structural heart? Well, valve is a part of structural heart, but all structural heart does not involve valves. What do I mean by that? One, we spoke about TAVI, which is aortic valve, but now we have patients with mitral valve disease, we have patients with tricuspid valve disease, we have patients with pulmonary valve disease, then we have patients with congenital heart, or kids born with holes in the heart, something called an ASD, which is atrial septal defect, something called a ventricular septal defect, which is something called a PFO, which is seen in adults. It's a form of an ASD which is seen in adults who develop stroke without a reason. So we want to cover this entire gamut. So we are looking after all these problems. We're not only looking after valve disease. And let me tell you one more thing. When a patient gets an echo done, he reads on his echo report that is called trivial 1 valve leak or trivial 2 valve leak. Sometimes it's written moderate 1 valve leak or moderate 2 valve leak. Somewhere it's written pulmonary hypertension. Somewhere it is written that this side chamber is dilated, that side chamber is dilated, and he is lost because he does not know what next. Does he need to be seeing a cardiologist? Does he need to get surgery done? Can it be left alone? Will that need anything to be done? So what we are proposing is that we are here 24 hours 7. If you have any queries regarding any structure of your heart which you do not understand, please contact us as Hinduja Hospital Khar. We are more than happy to answer your questions. We will meet you, our team will meet you, and will plan for you whether you need something, do you need to worry about it. If you need something, what is the best therapy for you? Whether it's going to be left on medicines, how much follow-up do you need, when do you need to repeat an echo, will you need surgery, will you not need surgery, will you need our kind of therapy, which is percutaneous therapy. So we are going to give you a holistic approach to this structural heart disease, which will include chambers, valves, and it will include each and every part of your cardiovascular system. Now let me give you one more example, or rather 2 examples, which we have done at Hinduja. We did this the first, again in Western Maharashtra. It was a tricuspid valve disease, where the right side of the valve was leaking, and the patient came down from a foreign country because there she was said you cannot do anything surgically, and they did not have those valve therapies. She came to us with that label given to her that you are going to die in 6 months to a year. So when we saw her, we definitely realized that she was in dire straits. We researched, we read a lot about what best can be done for her. Then we came upon a therapy which is called a trick valve, wherein we put two valves on the right side of the heart, one above the valve, one below the valve, so that we reduce the back pressure due to this valve problem. And by the time we put that valve, which was incidentally the first in Western India and second in entire India, we saved her that life. Now it is 5 years down the line, she's still alive with no problems and the liver is settled. So TAVI doesn't mean we're talking only about aortic valve disease, we're talking about everything else. And third patient, the patient I was talking about, was a failed mitral valve. So it's not only aortic. In this failed mitral valve, he was 86-year-old, and again, at that age, repeat surgery is out of question. So we went and put another valve and valve without surgery, and again he is doing well for the past 2 years. So we are open to do many of these procedures at Hinduja Hospital and geared up to take care of you at any given time. So if any one of us or any one of you has problems probably related to the heart, which can be chest pain, breathlessness, or it can be you feel giddy, or you feel that you're going to black out, the first thing one must do is get to the closest hospital immediately. Once you are stabilized, and of course if you're close to PD Hinduja Khar, contact us, we are available 24/7. But once you're stabilized in this hospital, and if you have a preliminary diagnosis, feel free to contact us anytime, and we are able to help you for your all structural heart related concerns at any given time.